All right, so let's bring in infectious disease specialist Dr. Joanne Passalacqua now. She's with Hartford Healthcare, St. Vincent's Medical Center. Doctor, thank you for being here.
Thank you so much for having me.
All right, so let's talk about New York City's reopening plans. You see what's taking place. Many business owners aren't happy about it, but the mayor says this is the way to move forward. What's your take on it? Do you believe it'll help curb the spread of the virus?
Well, I think anything that encourages people to be vaccinated will help curb the spread of the virus. It seems that this particular choice by New York City is a bit controversial, and I can, understand the frustration of the business owners. But ultimately, I think the more acceptance of vaccination we have nationwide, the quicker we're going to get this pandemic under control.
Well, if we're talking about controversy, I can do you one better, doctor. Let's talk about masks in schools, right? New study finds pediatric cases of COVID-19. They're on the rise tonight. The American Academy of Pediatrics reported more than 121,000 such cases last week alone. It's an 18% of all cases in the U.S. right now. A number has been rising since the beginning of July. And while a newly released survey shows 70% of Americans favor masks in school, many parents do not. In fact, there were new protests again today calling for an end to face coverings in schools. Take a listen.
Just another form of too big government overreaching its rights.
What they did to these kids this year is just awful. And I can't send her back in a mask. I won't do it.
Doctor, I'm not going to ask you to wade into any kind of battle on that front, but I would like to ask you about the efficacy of masks in schools. Do you believe they should return in the fall?
I think it's a choice between masks or keeping the children social distanced, and I guess that depends on the facilities at each individual school. But children under 12 don't have the option for vaccination. So, they are going to be extremely at risk as school returns this fall. And we're seeing with the new Delta variant, increased numbers of cases among children. So I think ultimately we have to keep our children safe. If there's a way to have them properly distanced in the classroom, perhaps this would be most ideal. But in settings where the children need to be closer together, then a mask may be the only way to keep them safe.
Well, doctor, what about that rise in pediatric cases? Because, you think back to the origins of the pandemic, and the one saving grace, so to speak, for parents was the belief that, well, it's not really affecting young children. They're not really spreading it the way older folks are. Well, that may not be the case now. What's behind the numbers?
I think the rise of the Delta variant is behind the numbers. Delta appears to be not only more infectious, but perhaps more severe than the original strain of virus. So, where cases in children were rare early in the pandemic, they're apparently no longer rare. I'm not a pediatrician. I'm an adult medicine doctor, but certainly there's plenty of data suggesting that children are getting sick with COVID.
Yeah, it really is eye-opening, doctor. Let's take a closer look now at some of the numbers across the U.S. As you mentioned, the Delta variant continues to spread. So you look at the Johns Hopkins statistics, the 7-day case average is up about 15% from a week ago, and deaths are up 37% from last week. Doctor, again, is it all due to the Delta variant, or are there other factors at play?
Well, the other factors are poor vaccination rates in many parts of our nation. And, the highest rates of virus appear to be in areas of the country where vaccine rates are low. We here in the tri-state area are certainly seeing cases of COVID and sometimes breakthrough cases of COVID, but the rates are significantly higher as we move to regions where vaccination rates are low.
Right.
So vaccination is key.
All right, Dr. Joanne Passalacqua, thank you so much for joining us here on The New Normal. Well, a major